From the KDLM studio, it's time for Hodge Podge, presented by Partnership for Health and airing on Lakes TV3.
It is 9 o'clock on a KDLM Tuesday morning. Of course, that means Becker County Energize, and we're doing our Zoom meeting. And joining us this morning via Zoom is Julie Smith and Rebecca Kent. Julie and Rebecca, good morning. Thanks for being with us on Hodge Podge today.
Hi. Morning.
Glad to have you both with us. So let's talk a little bit about the Rural Opioid Grant Project. First off, let's find out from you two, what does Becker County Energize mean to you, and why is it important?
Okay. Well, I'll start off. So Becker County Energize's movement to create healthier communities and improve the quality of life within Becker County. It takes a look at the community health reports, and it looks at how it can partner up with other organizations and people in order to address those health-related topics. And so really what that means for me is when it comes to your health and for making a change, it takes really a lot of people coming together and working together collectively to make a difference, because these issues that we're tackling aren't simple fixes. They take time, and they take a large movement of individuals to work together to make a difference. And so it's really exciting to be a part of that and to help make a difference within our community. So
maybe a little background on the Rural Opioid Grant Project for folks who aren't familiar with what it is.
Yeah. So the Rural Response Initiative, Initiative is for, it's funded through the Bureau of Justice Assistance, and it is a grant that is for addressing the opioid issues in rural America. And so it is a 2-year grant project that we have, and we were one of 21 sites across the United States who were awarded that grant, and we have $635,000 to help address the opioid epidemic and reduce the amount of fatal and non-fatal overdoses within Becker, Hubbard, Polk, Monoman, and Norman counties.
When we talk about the opioid pandemic, or not pandemic, but the opioid situation here in our local communities and counties, a lot of people aren't aware of that we have any issues with it. So maybe Julie or Rebecca, one of you could talk about what type of a situation from an opioid problem do we have in our local rural counties here in Minnesota?
Well, from personal experience, I've worked many years on the reservation and in Becker County. I worked at the crisis center here in town doing individual and group therapy. And so opioids really have a grip on many people in our community, and it's something we don't often see, but it's there. And when we can get people the help that they need to get off of opioids, then that is going to help them with their mental health, their physical health, all the other things. So it is a problem in this area, and I think maybe Rebecca can talk a little bit more of the statistics on it, but I know from a personal experience, when we can get people off the opioids, it really helps in all areas of their life.
Rebecca, go ahead.
Yeah, so one thing I'll just point out there right away. So a lot of times when you think of opioids, people think of just your prescription pills that you get from your doctor. Well, that's not really the case. So opioids is any sort of polysubstance. When you think of polysubstance, that could be anything from meth, heroin, to fentanyl, to any sort of really polysubstance that is affecting people. So when you start looking at it that way, you start talking about, well, okay, well, I know people that have used heroin, or there's meth problems around, and it's one of the most addictive drugs out there. And within our 5 counties in particular, there's been a lot of positive drug screens in prenatal care. The number of drug-related arrests have increased. Also through the Danes reports, it's been identified that there's been a lot more issues, and of course within our law enforcement, there's a lot more drugs being purchased and seized on a daily level.
Rebecca, I think you make a great point. When people think about opioid addiction, we think of painkillers. You go to the doctor, you get a prescription, and the prescription runs out. You're like, gee, I still need a little bit of help to get through this pain. I think that's the mental picture that most people have when you talk about opioid addiction. They don't really realize that there's a lot more to it than just oxycodone, hydrocodone, and some of the other painkillers that are out there. I'll put this question to both of you. How has Becker County Energize helped your program be successful?
Go ahead, Rebecca.
What was that again?
I was just asking what kind of success you've seen with the programs through Becker County Energize.
Oh, yeah. So for the success, in particular, with this grant, we've had success through our partnerships. So for the rural responses to the opioid epidemic grant, we've partnered up with Essentia Health, White Earth Reservation, Becker County Human Services, Polk, Norman, and Monoman Department, Community Health, the Becker County Sheriff's Office, Compassion House, Catholic Health Initiatives, just to name a few. And so it's really been great for addressing this as a whole by collectively working together and having a lot more partnerships across the community. And so we're really making sure that we touch every corner of the county and address the 5 counties that this grant is working on.
And I think Becker County Energize has done a good job of getting so many different entities together. I know a group of us went out to Washington, D.C., and the collaboration that we got to do was amazing, because then when we came back and we're having weekly meetings, we had this foundation already there. So I think they've done a really good job of getting key players and key organizations together to help reduce the opioid epidemic in our area.
When we talk about that, we're a smaller community. We're not a large, giant population. I think the average person who travels through Detroit Lakes or Perham or Hawley River, you don't have the visible signs like you do in larger, big metro areas like Minneapolis, St. Paul, St. Cloud, Duluth, Mankato, like that. So I think it's one of those out of mind, out of sight things for the general public, because it isn't something, let's face it, we don't see little needles floating down the hallways here or the roadways here in Detroit Lakes. But it's still an epidemic. It's still a problem. And people need to be aware that not only is there help out there, but we do have some issues within our counties.
Yeah, and like you said, we don't have where people are on this sidewalk, tipped over from their overdoses. In rural America, like we're at, people are more sneaky at it, and they will go out into the woods where they aren't going to be seen, or they will drive down a gravel road, or they will find a location that they feel more comfortable. And so it's not very apparent in front of everyone's faces. But if you start digging and you start looking out there, it's in everywhere. And everybody knows someone that's been affected by it. And it's just something that people don't want to talk about because they feel uncomfortable and they don't want to shed light on something that isn't a pretty topic to talk about, because it really destroys people.
Rebecca, that is a great point, and I think anybody who's gone through an addiction, regardless of what the addiction was, has seen the impact not only it has on the abuser and the user themselves, but the far-reaching spread of family and friends. I think that's the one thing that people don't necessarily understand about addiction and the process of recovery, rather, is that it isn't just the individual. There is a large group of people around these individuals that is also impacted by the addiction.
Mm-hmm. Yep.
Before we let you guys go, anything else, Julie or Rebecca, that you'd like to get out and let people know about here through the Rural Opioid Grant Project?
Well,
go ahead,
I
Julie.
guess I'll just touch base a little bit more about our grant here. So we have identified some strategies that we're going to be addressing with our grant funding. So the Becker County Jail Diversion Program is a huge program that we have a lot of funding, just about $250,000 that will be going towards that to help address the opioid epidemic. We're going to be expanding the Father Project within Becker County and Hubbard County. We are going to be also doing a new pilot program, which is called the School Hope Project, which is a drug prevention program in schools. And it's going to first start out in Frazee, and the other site will be in West Fargo, which is very exciting to be a part of that. We're also going to be doing OD map improvements, which the OD map is the drug overdose detection mapping. And that is our only real-time data for overdoses that we use for tracking that, so we can see when there's spikes or when there's increases or anything like that. We also are going to be doing increased naloxone training and create some educational campaigns around the stigmas and try to shed light on the opioid problems across the 5 counties. And then finally, we are going to be doing a post-treatment sober living resources for individuals with a substance use disorder. And we've partnered up with Compassion House, and we're going to provide some housing locally here in Detroit Lakes. We're going to start out with 1 house and hopefully grow to a couple more houses. And we really have a huge issue that we're tackling over the next 15 months here, but we're really striving to work with our partnerships and our collaborations to help reduce the amount of fatal and non-fatal overdoses that is continuing to happen in our backyard on a daily level.
Julia, go ahead.
And I just wanted to give a shout out to Rebecca and Karen Pfeiffer, Becker County Energize, and Essentia Health, because they've really worked hard. This has been something with the pandemic going on, like, oh my gosh, what are we going to do? Because originally we had this plan, and they have just really been able to figure things out, and we've still been able to move forward with all of these great initiatives in our community. So I just wanted to thank them, and there's going to be a lot of great things happening in our community to reduce opioid.
Julie, you bring up a good point, and I'll make this my final question to both of you. During the pandemic here, how have things changed as far as abilities for folks to stay in contact with people such as yourselves?
Well, we've been doing a lot of Zoom and Skype and Teams meetings, and we are practicing, social distancing as best we can. I think, we've just tried to adapt as best as we have, and to keep on working on things because it's not stopping. And with COVID in particular, with everybody being locked down and losing their jobs and different things, the amount of opioid overdoses and overdoses in general are continuing to rise. And so it's going to be a problem that's going to have a ripple effect because of this social distancing, and a lot of mental health issues have arisen when people are isolated and they turn to things that they normally wouldn't, or, so it's something that we're going to be seeing a lot more of, and it's something that we have an opportunity to address. And our team's been great for making the effort to meet all the time and to connect as best we can, and just using technology to our full advantage.
Julie?
And I think this is a great opportunity to bring up that this takes a whole community. And so when we think of, Rebecca mentions the increase in mental health issues going on. I know the Crisis Center in Detroit Lakes has really done a good job. Other places just rising up and saying, what can we do? What can we do together? And I feel like as our team, we pushed through, we continue to meet every week. We met the grant deadlines, and we're getting the funding out. So I think just that continued effort at a community level is really going to push us through and to continue to have hope that things will change and get better.
Before we wrap things up this morning, contact information for people who might want to find out more information about some of the services that you guys offer.
Yeah, so you can go to BeckerCountyEnergize.com to get contact information. Otherwise, you can connect up with me. My name is Rebecca Kent. I'm at Essentia Health, so rebecca.kent@essentiahealth.org. Otherwise, yeah, just connect up through the website. Karen Pfeiffer's information is also listed under the Becker County Energize website if you go to connect up on there. But I would just encourage you to go to the website to get that contact information.
Julie?
Same thing. I'd have the same recommendation.
All right. Well, Rebecca Kent, Julie Smith, thanks so much for joining us here today on our Becker County Energize Hodge Podge edition. Thanks for joining us this morning.
Yeah, thank you for having us.
All right. That is Hodge Podge here for this Tuesday morning.